Share on Pinterest. When it comes to body contouring, people are continuing to seek out non-invasive procedures. These procedures are different from invasive surgeries. They carry fewer risks and side effects without the need for extensive downtime. One such contouring procedure is the vacuum therapy butt lift. Unlike the traditional Brazilian butt lift, vacuum therapy promises to help tone and tighten your ear without the use of incisions and fat grafting. While the lack of downtime and scarring is much more appealing, vacuum therapy doesn't offer as many significant effects in terms of buttock sculpting. If you're wondering whether vacuum therapy is right for you, this article will help you learn more about the procedure so you can discuss your options with a board-certified provider. Read on. What is vacuum therapy? Vacuum therapy is a non-invasive massaging technique that helps to lift your skin via a mechanical device equipped with suction cups. While it originally entered the market during the 1970s as a way to help treat burn scars, this treatment has evolved into a non-surgical butt lift method. Some studies' trusted source have also looked into the therapy as a way to close up skin ulcers. Vacuum therapy is also known as vacuotherapy and depressomassage. Aside from purportedly offering similar effects to those of a surgical butt lift, the procedure is also sometimes used to mimic a traditional breast lift. Certain forms of vacuum therapy are also used for the treatment of cellulite. One such therapy is known as endermology, which was the first FDA-approved treatment of its kind. It works by reducing swelling in the affected skin to help decrease the look of cellulite dimples. However, endermology doesn't have the same lifting effects that traditional vacuum therapy is said to have. Does vacuum therapy work to lift and sculpt the buttocks? At its core, vacuum therapy offers deep massaging effects. The procedure may work for buttock toning by decreasing muscle tension, increasing lymphatic flow to remove toxins and water retention, exfoliating the skin, thereby making it smoother and more toned in appearance, as stimulating the middle layers of skin for increased toning effects, decreasing the appearance of cellulite. When performed for several sessions on a weekly basis, you may notice that your skin is tighter and more toned. This can provide the appearance of a butt lift. What the research says: there's very little scientific literature to support vacuum therapy as a viable alternative to a surgical butt lift. Some experts have even suggested that the effects are minimal and temporary at best. Sometimes the procedure is recommended as a follow-up to more invasive surgeries, including liposuction. Results aren't permanent. Once you stop going for vacuum therapy treatments, your skin will likely go back to the way it was before. If you're looking for more permanent results, you may consider talking to your doctor about surgery instead. They can help determine if you're a candidate for more invasive procedures. Surgical treatment options can include fat transfers via the Brazilian butt lift, butt implant, self-ina, a type of cellulite treatment. Liposuction. Is vacuum therapy safe? Vacuum therapy is a non-invasive procedure, so you can expect few to no side effects. However, you may feel slight pain and tightness after the procedure. Mild swelling can also occur. How much does vacuum therapy cost? The exact cost for vacuum therapy will depend on your location's provider, the extent of your treatment area. One provider charges $85 for a 1-hour session. Keep in mind that you'll likely need multiple sessions to achieve the desired effects. It's also not permanent. Vacuum therapy is considered an aesthetic procedure, not one based on medical needs. Therefore, it's not covered by insurance. Talk to your provider about any discounts or promotions, especially if you're planning on undergoing multiple sessions. Where to find a provider? All cosmetic procedures should be performed by a board-certified provider. This includes non-invasive treatments like vacuum therapy. When researching prospective providers, Be sure to ask about their education, training, and experience with this procedure. Ask these questions at a consultation prior to your procedure. You should also have the provider show you a portfolio of their work. Steer clear of any facility that offers vacuum therapy at an extremely low cost without any credentials to show for it. You can start your search via the American Society of Plastic Surgeons. Takeaway: while the procedure can potentially lift and tone the buttocks without any side effects, the effectiveness of vacuum therapy remains in question. If you do decide to try this procedure, make sure you understand all the costs and time involved. You'll need multiple treatments for up to several weeks to see full results. Remember, the results aren't permanent. Consider talking to a board-certified dermatologist or cosmetic surgeon about all your options. Depending on your situation and your overall goals, they may suggest an entirely different treatment.